Good afternoon and welcome to Mercy Health Muskegon's Healthcare Spotlight. This is your host, Katie. Each week, Mercy Health will bring you important and helpful information that guides you in becoming more informed and more involved in your healthcare decisions. Carefully listening to you and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health. Today, we're talking about the NICU Transport Unit with Jet Benson, Neonatal Transport Coordinator, and Kim Burrow, Clinical Manager of Mother, Baby, and Pediatrics at Mercy Health. So, Jet, can you explain, what does NICU stand for?
Yeah, Katie, NICU stands for Neonatal Intensive Care Unit.
And why would a baby need a NICU?
Any baby that's born prematurely or too early or has complications after they're born, such as difficulty breathing, low blood sugars, or various other concerns, are all candidates for a NICU admission.
And so Kim, who's also here with us, what babies tend to stay at the Hackley campus, the Level 2 Special Care Nursery?
We can keep infants born as early as 32 weeks, and that includes those that are learning to eat and breathe, and basically those babies that can maintain their airway without long-term respiratory support.
What is long-term respiratory support? How would you define that?
Babies that do not require CPAP, which is continuous positive airway pressure, or placed on a ventilator.
Okay. So how many babies a percentage of babies born, how many of them would need a NICU?
Approximately 15 million babies are born prematurely around the world, according to March of Dimes in 2017, every year. Also, March of Dimes says that about 9.9% of infants in Michigan are born prematurely. They give each state a scorecard. And Michigan ranks a C in the United States.
A C? That doesn't sound very good. That seems about average. So
it's about average. We can definitely do better.
Definitely. What are some things that people could do to maybe avoid? Is there sometimes something you can't do to avoid having a baby in the NICU?
It's really difficult to predict factors that will lead to a baby being in the NICU. Sometimes if a mom is having premature labor or a lot of complications, or there's more than one baby, maybe they're having twins or triplets, neonatal specialists can meet with families before their delivery to help prepare them for a NICU stay. Sometimes it's unpredictable.
Yeah, that was going to lead into my next question about, do families ever plan on having their baby in the NICU, and what are those conversations like for the provider and the families?
Yeah, so the earlier a mom seeks care, the better we are able to prepare her if there is a potential for a NICU stay. So if mom is receiving her OB care early and referred to a neonatal specialist due to any of the reasons we talked about, maybe there's twins or there's other factors complicating the pregnancy, they can certainly meet with neonatologists or our nurse practitioners or PAs who can help to prepare them for what that stay might be like.
And I, having given birth to 2 kids myself, that was never a conversation with my OB about, in case you ever have to go to the NICU. Is that something that most physicians tend to deal with as it happens, or is that? Should people be more prepared to? 9.9 is about 1 in 10. So should people be more prepared for the chance that they could stay in a NICU?
I think that NICU is often the unit that people don't know exists, but is very thankful is there. Mm-hmm. I think it's something that we should certainly be aware of in the States, something that we should be talking about, and risk factors for prematurity. There are definitely racial and ethnic disparities in that, and we need to be discussing this as part of our health care. And we're always happy to support moms and families in that education. Some of our OBs do provide that education depending on what's going on in the pregnancy for their moms. And we do offer a lot of educational services and media related to our transport and NICU services in both facilities here and at Mercy Health St. Mary's in Grand Rapids.
Great. You mentioned some risk factors. What are some of those risk factors that you mentioned, like premature labor? What are some other things that...
So high blood pressure is a potential risk, infections. So if mom has a history of infections or is struggling with those kinds of complications. Any other type of factor as far as working with their OB, sometimes the OB has a better idea of what factors they'll be looking at. So sometimes mom's water will rupture prematurely, and so if that ruptures early, they become at risk for premature birth.
Okay. Wow. Lots of factors, multifactorial. Okay. So Kim, how is emotional support for these families every bit as important as, the clinical care that our families receive? Because I imagine it's quite a scary time for people. You've just gone into labor and then you have a baby who's needing some specialized care.
It is. Emotional support for NICU and special care families is essential in providing our family-centered care. And I would argue that part of the NICU clinical expertise. Having a baby in the NICU is not a normal birth experience, and it can be very scary and challenging for many of these families.
So what do we do at Mercy Health, to provide that emotional support?
We have a great staff that the nurses are wonderful at providing that support. We have a dedicated social worker that is also able and willing to help. We have our nurse practitioners, our neonatologists that are also very wonderful at providing all that support as well.
So give me an example of what something would be that would be a great story or kind of like an anecdotal thing that we do, Jet.
Yeah, so speaking of our transport families, so there was a baby that was born at Mercy Health Muskegon and had to be transferred, unfortunately, to Mercy Health Grand Rapids for a slightly higher level of care, level 3 NICU care. But because our nurse practitioners work in both facilities and our neonatologists oversee both units, we were able to FaceTime with the mom during our morning round so she could see the baby and get an update in real time for the plan of care, and her children were able to see the baby even though he was in Grand Rapids at the time.
Oh, that's awesome.
Yeah.
So you mentioned about the NICU transport. So let's get into the nitty-gritty about what is the NICU transport unit and who runs it, all of that.
Yeah, so the Neonatal Transport Unit is basically a fancy way of saying we have a dedicated ambulance and equipment and a specialized team to care for babies who need to be transferred to a higher level of care. So NICU transports are really different from a typical ambulance transfer. If you or I were getting to an ambulance, we're being taken to that higher level of care where we're going to see the doctors we need, we're going to see the specialists and get the testing done. What's different about NICU transport is that we actually bring the neonatal ICU to the baby. We bring the specialized isolette that keeps their temperature warm. We bring the blood pressure monitor. We bring all of the IV pumps and fluids. We bring all of their solutions as needed. And our team is our specially trained respiratory therapists, RNs, our advanced practice providers, so our nurse practitioners and physician assistants, or our neonatologists will go depending on the situation. And they come to provide that specialized care, stabilize the baby, and then transfer back with the baby.
Okay, so it's a specialized ambulance, and if you ever see it on the road, what does it look like when you see it going down the road?
So the Mercy Health ambulance was actually designed by our staff. It's got a big red part of the logo, and then it has little kids playing along the side and superheroes poking out of the back windows of the back door. So you'll see, I think it's a Spider-Man and a little kid superhero if you take a look and you're driving behind it, with Mercy Health Neonatal Transport Team on the side. It's really cool. We like it a lot, and we've partnered with AMR, and it's been wonderful for the last 2 years.
Great. So yeah, you've mentioned it's been in existence for about a year and a half, 2 years. What have some of the results been from a clinical perspective and from your perspective?
Yeah, so we went live with the transport program in January of 2016, and we've had 67 transfers to Mercy Health St. Mary's since then. We have started working on back transfers, so being able to transfer some of our babies back to Mercy Health Muskegon when they meet clinical criteria. And we've been able to provide consistent and continuous care for our families from Mercy Health Hackley to Mercy Health St. Mary's, providing opportunities for them to be with their baby and see the same physicians. They partner with social work in both locations, and we offer our amenities like Sophia's house as well.
Okay, so you talked about back transfers. That's when the babies come back to the special care nursery in Hackley campus, correct?
Yeah,
Yes.
so some of our transported babies are born really early. So if a baby's born at 26 or 23 weeks gestation, they're too small to stay at the special care nursery until they get a little older. So once they meet the clinical criteria, we start considering if they are ready to come back to Mercy Health Muskegon, and if that's supported through insurance, and if that's what's best for the family, we work to ensure that that can happen. Our neonatologists see those babies in both locations, so our neonatologist accepts the transfer back for the baby. And so then they are able to continue that care in their home community.
That's great. And then what has the feedback been like for those families who are able to then come back to Muskegon? Because, it is quite of a drive, from Muskegon to Mercy Health St. Mary's in Grand Rapids. And, for families, they want to be with their babies, I'm sure. So
yeah, so it's a really new process for us at this point. The special care nursery, we received licensure designation in January of 2016 for the Level 2 special care nursery at Hackley. We have started having our neonatologists on site 7 days a week in June, and so this is very new.
Wow.
We haven't had a baby back transfer yet, but
Okay.
we're hopeful that one will soon.
that sounds really great. So how does it happen? Like, who makes the decision to send a baby to Mercy Health St. Mary's via the transport unit? Can you kind of walk us through that whole process, Jet, of getting that call and what happens and, how the babies get transferred?
Yeah, so usually there's a pretty good idea that this baby might need care if it's going to be early, or if the baby comes out and there are complications after delivery. It's a collaborative decision that's usually made with the pediatrician or with the neonatologist on site. They'll call the unit in Grand Rapids and discuss with the neonatologist there. Together they'll make the decision that the transfer needs to happen. And then the neonatologist in Grand Rapids will deploy the team who comes and picks up the baby at that point.
Okay, and so the team is deployed. What does that look like from your end in Grand Rapids when the team is deployed? That sounds, kind of exciting.
Official, right?
Yes.
So when the team is deployed, we make sure that we have a transport nurse and a transport respiratory therapist ready to go, and our transport nurse practitioner comes in. Usually they're on call, and so everyone is ready to go, including all of our equipment, supplies, and ambulance within 60 minutes of the call.
Wow. So it seems like this is an intense process. Minutes count as you're bringing this ICU to these babies. So what kind of training is involved for people to be part of this specialized transport unit team?
Yeah, so that's a great question. Many of our nursing and respiratory staff didn't do transports prior to us going live with this program in 2016, so we had to be really innovative and creative with how we were going to do this training. And the way we came up with was to do simulations. So we stepped out from the clinical setting, got in the back of the ambulance, and crafted different scenarios with an interdisciplinary team. So everyone who goes, the respiratory therapist, the nurse, and the practitioner. And I walked them through what that looked like. They got in the back of the rig. They used real supplies. They actually simulated outpatient scenarios. I made them pull over to the side of the road. I made them work on clinical decisions during that time and stabilize. And after the training, they felt that that was really beneficial, and we've continued to do those in addition to the transports that we've done. So we do different opportunities for competency checklists, skills labs, simulation sign-offs, and then required classes.
Very cool. You talked about the interdisciplinary team. Is that a large team? Is that a small team? I mean, how many people are?
It's usually 3 to 4.
3 to 4 people. Yeah. Okay. And do they all fit in the back of the ambulance?
They do.
They do, because the patient's very small. It's little patient. So very cool. And then how about the mom? I mean, the mom who's left. Does a baby come to Grand Rapids? Is she usually discharged to come to Grand Rapids with the baby?
So it completely depends on her stability, and that decision is made with her OB physician.
Okay.
So if her OB physician determines that she is stable for discharge and discharges her, she can ride along in the front of the rig. If she's not stable, we do offer that a significant other, either her parent or her significant other, whoever has her second band, so her parent band when she comes in the hospital, can ride along in the front of the rig with the baby.
So the bands are important. They identify who has ability to hold the baby or to be with the baby correct at the hospital at all times, because patient safety is our number one priority. Mm-hmm.
Absolutely.
And we do try to work with the OB providers to get our moms out as soon as they're stable, for those that cannot leave when their baby does.
Great. And then you had mentioned too, Jet, about Sophia's house, and tell us a little bit about the Sophia's house.
Sophia's house is a place where our families can come to stay. They are offered rooms, and there's opportunity for them to essentially come and live down in Grand Rapids temporarily at a low or no cost, depending on their situation. It's a really beneficial environment, and it's right across the street from the hospital, so it really promotes that bonding, helps our moms to stay close to their babies, because we know that this can be a challenging time.
And then staying close is so important as, the healing process. Can you explain how important it is for babies to have their families and their moms close by?
Yeah, so babies benefit tremendously from having their mom's voice, having their mom's touch. The first thing a baby recognizes is their mom's smell. So as soon as we can put that baby skin to skin with mom, the better. Babies stabilize their heart rates and temperatures. And if mom is close, she's able to pump and bring her milk right over. And breastfeeding is so important. These babies benefit so greatly from having that readily expressed breast milk. So our premature infants really do need their moms close by.
That's great. And that Sophia's house, I believe, is celebrating its 5th anniversary, and it's catered to thousands of families in Grand Rapids. So I'm sure that, that's a great relief for families that are coming from Muskegon. They have that option.
Definitely.
To be close to their babies, because that would be a concern to gain a hotel or driving that distance every day would be very hard for folks. And so another question I was going to ask. So we talked about what are some other considerations, for this transport unit? We talked about kind of specialized care, the specialized look. I mean, we take care of babies. I mean, do twins fit in the back of there? I mean, is it? I just have lots of questions about this cool specialized ambulance.
Yeah, so there's a couple ways that you can take twins back. Sometimes 2 will fit in the same isolette, and then other times, depending on their stability, if they're sicker, we'll do 2 trips. So we'll bring a larger team and leave a nurse here at Mercy Health Muskegon with that baby. So essentially, we're bringing an ICU nurse to come and provide that ICU care for as long as it takes.
Oh, wow.
Yeah, so it's kind of nice. And actually, we had a set of twins who were young. I think they were 26 or 28 weeks. And Dad rode back with the first one, and then we came back and got the second one, and Mom was able to ride back with the second.
Oh, that's great. So a parent was with the babies at all times.
Yeah.
So that's really special to have that care. So, Kim, can you tell us a little bit more about the birth center here at Hackley? I mean, as you mentioned that they've recently achieved a level 2 status. What does that mean for families here at Muskegon?
Oh, that's really exciting for our families here. It's just a great way that we can keep our families together with babies that need a little extra support. We encourage our families to be a part of their care as long as we can while the babies are in our special care nursery. So, again, it's just a really great thing for our community, and we're really excited about it.
Great. So what kind of special did you have to undergo with certain testing, certain achievements, or how is that determined, like a level 2? How did you get to that?
So there was an application process through the state of Michigan that was pretty intensive. It was a little bit above my background, but essentially what it came down to is we had to meet certain criteria for space, equipment, staffing. We had to say that this was our intention, these were how many beds we planned to have, and we had to have a reciprocal relationship in place with the transport program, Enter Mercy Health St. Mary's Transport for neonatal care. So when we got the approval for that, it allowed us to continue caring for the babies that we already have been caring for who were a little bit sicker. The state of Michigan guidelines changed in 2016, and so we wanted to make sure that we were able to continue that care here at Hackley. And it also expanded our ability to care for babies who are younger and a little sicker than we had previously. So we're able to keep more babies in the community, providing that care that they need.
And that's great to hear that, too, that although we have this fancy transport unit, the ultimate goal is to keep babies here in Muskegon close by their families.
With their mamas.
With their moms.
Yes, absolutely.
So that's really great to hear. So we talk a little bit about the rules. Did the laws change to make things stricter, more stringent for NICUs, or is it...
So the state of Michigan set out new guidelines as to what defined a level 1, level 2 nursery or special care unit in 2016 that took effect. And so essentially Mercy Health Hackley had to decide which they wanted to become. And so in order to step into that level 2 role, which the community decided they very much wanted and Mercy Health wanted to provide, we had to meet those certain criteria that we outlined.
Okay. And you correct me, because level 3 is at Mercy Health St. Mary's, and level 3 is the highest level, correct?
It's a level 3, yes. So in the state of Michigan, there is a level 3 designation as the highest. Mercy Health St. Mary's provides care for babies 23 weeks gestation and up, provides ventilator support, oscillators, and provides care for our smallest and sickest patients. We do not offer pediatric surgery specialties or nitric oxide at this point.
Okay. And talk to me a little bit about, we mentioned a little bit about mom's breast milk expressing milk close by. I know I've heard this initiative, Baby Friendly Initiative. Can we talk a little bit about, just the importance of breastfeeding and what does that mean for baby friendly, and just talk a little bit about that?
Yeah, so Mercy Health St. Mary's is in the process of becoming baby-friendly designated, and Mercy Health Hackley is doing many of the steps as well, supporting breastfeeding and supporting that World Health Organization goal of having I forget what the breastfeeding rate is, but it's a higher breastfeeding rate by, I think, the year 2020. And so we're working very hard to ensure that we are supporting those as a region. So one of the initiatives that we utilize a lot at the NICU is making sure that our moms are pumping frequently. We try to expose babies first to breast milk, to mom's breast milk. So if mom wants to exclusively breastfeed, we don't give the baby formula right away. We'll try to wait until we have that milk from mom, that liquid gold, as we like to call it.
And at Mercy Health St. Mary's, too, we do have a program where we have human milk.
We
correct,
do.
for donor human milk.
Yes, yeah. We offer express donor milk that is screened and scanned and DNA matched. It's very safe to give to our babies, and we are able to give it so if a mom isn't getting a lot of milk just yet, or if they've struggled with supply, we can supplement with that donor milk while they're in the hospital. That's
great. I'm sure that eases lots of moms' minds. What's their reaction when they find out, if they're struggling with producing milk? What's their reaction to having that?
Usually moms are really relieved that we have that option available to them, and it helps to take some of that pressure off. And we all know that stress is not great when you're trying to pump. So the less stressed a mom is, the better she'll do. So we always try to help them and support them with that.
That's great. And that ties into that emotional support, being there for the families. So That's great. So Kim, tell us so there's some exciting things happening with the construction project.
Oh, yes.
And so how does that affect the birth center here in Muskegon? What's some new stuff going on with that?
Well, the plan is to all move over to the tower when it's complete, and that is located at the Mercy campus. The plan is to move in the summer of 2019. The nice thing about it is the Women and Children's Services will all be on one floor, and I believe it's going to be the 4th floor. So that'll be exciting to have all of that together.
Great. And so I've kind of gone through like a mock-up of some of the areas. So, what are some of the new amenities that you're looking forward to in the new center? Is it like a special ambiance, or just because what are things like here at the NICU? Is the specialty care nursery in Hackley, is it all on the same level floor as? Okay.
Yes. We will all be on the 4th floor. So our special care nursery will be located there. Our pediatric unit will also be off a branch on that floor as well.
Oh, perfect. So they'll be all the one area. That's great. So are there any final takeaways that you want people to know about the birth center here at Mercy Health? Anything that we offer that's really special that people should know about our units?
Well, I think everything about our unit is great. We have wonderful staff. We have great nurses. We have nurses that are very dedicated to taking care of patients and putting the families first. We have a great lactation support team. We get a lot of wonderful feedback with that. Not only do we have lactation support, but our nurses that are on the floor as well are do a very good job with lactation support and helping our moms to be successful with breastfeeding.
What kind of difference does a lactation support? How does that help moms with their with their goals for breastfeeding?
Well, we have 2 lactation consultants that are certified, and they provide support groups for moms that are discharged that can come in as well and meet as a group if they're requiring a little more help. Also, they will tend to meet with each of our breastfeeding moms. If there are moms that are having difficulties, they'll spend a little bit more time with them as well and set up a plan to help them be successful.
That's awesome. Now, are these one-on-one consults, are those free? Can you call, what's the phone number that people could call to find out information about these?
This actually is what our lactation consultants do when a mom is admitted and has a baby.
Okay.
And once they come to our postpartum floor, they're available for that.
Okay, so people, once the moms come and are admitted to having the baby, then they have these one-on-one consults with a lactation consultant before they leave the hospital, correct?
Yes, the lactation consultants will round on each of the patients, make sure that everybody is doing well. For any of those that are having difficulties, they set up a plan, they follow up with them. And then also in addition, our postpartum nurses are also a great resource to help with lactation.
Great, and you mentioned those support groups. Are those free of charge?
Yes, currently they have a couple of times a week that they meet, and the lactation consultants give that information to our moms before discharge, and they meet different times and during different times of the week, and it's for an hour to 2 hours.
Oh, great. And so people can probably find out more information on mercyhealth.com about the times and locations for those breastfeeding support groups.
Yes, absolutely.
Perfect. So, Jet, from your perspective, are there any final takeaways about the NICU transport? Anything else that you'd like our audience to know about how we care for babies at Mercy Health?
Yeah, I think it's really exciting. We have created a really unique program here where we have partnered between 2 hospitals to provide seamless and collaborative care for our babies. So it doesn't matter which hospital you're in, you're receiving that amazing care from the same physicians, from nursing staff, from physical and speech therapists, from respiratory therapists who are all committed to making sure that our focus is family-centered and patient-centered care for these babies. We're working really hard to ensure that the experience that you have at St. Mary's mirrors the experience you have at Mercy Health Hackley and vice versa, so that families feel that transition as little as possible and they feel really prepared to bring their babies home, even if they start in Grand Rapids or if they start in Mercy Health Hackley.
Great. Yeah, and having a lot of the same staff at both locations, I'm sure that eases lots of people's minds, the family's minds, to see familiar faces and people that they've worked with on their babies. That's really helpful. Absolutely.
And it helps because the providers all know their babies too. So it's not nearly as foreign to go to a new place with strange people. It feels like home.
That's awesome. Well, thank you, ladies, so much for your time today and explaining to everyone what the NICU Transport Unit is about. And so I want to thank you again for your time. So today's broadcast has been brought to you by Mercy Health Muskegon. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health.